I get to know our patients very well. I think they become part of my family. I worry about them. I'm happy for them. I'm sad for them. My patients are my home away from home. I feel as my role as a dietitian is to make sure that they're successful, just like I would make sure that my own children were successful or my family was successful. Sometimes I will see our patients at the Y, swimming, or on the treadmill. I will run into them at various road races around here. And that's a very empowering feeling as a provider to know that I've helped promote that healthier lifestyle and that level of activity, that they're getting out, they're getting active, their families are getting active. I see a lot of patients who are out with their families at these different events as well. So it's not just about the patient, but it's about the family becoming healthier overall. They're full of pride, they're full of joy. They love if they run into me and they see me because it shows, look what I'm doing and look how successful I've been. And again, it comes back to that comprehensive. It's not just about the weight loss, but it's about establishing healthier habits overall. Very empowering to patients. Some of them I will see cry because they've accomplished it, or just excitement and hug. I'm a big hugger, so I will usually go up and hug them, But it's that collaboration with patients that we develop. They may not have that confidence factor when they first step through our door. And I think that that's the greatest thing that we get to see as a bariatric program, is that progression towards that confidence and that empowerment that they're able to provide. And there's many different ways to get from point A to point B. And there's many different journeys for many different patients. But I love when I get to see that point B. We get to know the patient as a team, as a whole. Nutrition is just one small component of the bariatric program or the bariatric surgery. I think getting to know both the physical, the emotional, how they're eating and how we can change so that every time the patient comes in, we're able to identify all of those areas as an individual provider, but then also as a team. I think we just care about our patients. I think that we go the extra mile to make sure that our patients are successful. And not just from a bariatric standpoint, but long-term. Not just through their surgical procedure, but long-term. We have support groups. We have speakers that come in on all different subjects. The patients are involved in making those decisions on what types of speakers they may want to come in, what's important to them. And I think that that's what we can really offer, is we take the time to listen to what their needs are so that we can meet their needs. Dr. Baranoff is a fantastic leader. He is extremely detail-oriented. He is very knowledgeable on all areas of weight loss and bariatric surgery. He has really helped Saratoga Hospital establish an elite bariatric program that allows our patients to be as successful as possible. But he also brings that human factor into it by carefully following his patients, carefully following up with patients that he refers out to different specialties to make sure that the patient is being followed medically in any area that they may need. And also just being there for the patient and putting the patient's mind at ease as they're going through this journey. I think Saratoga Hospital Bariatric Surgery and Weight Loss Program is awesome, and I am glad to be a part of it.